Hi, I'm Brad Kramer. I'm the manager of the Climate Health Equity Initiative at Public Health Seattle and King County. We spent the past year or so working with our healthcare partners on how to do more at work in climate change, and I'm here to share with you some of the great things we learned with our partners. This will be done in 4 sections. The first section is mitigation. This is how our healthcare systems are becoming more carbon neutral. Section 2 is data and strategic planning. We're going to talk about how we brought health and climate data into our community health needs assessment. Section 3 is preparedness and response, how we can support our healthcare system to become more resilient during climate impacted events. Section 4 is adaptation. This is how we can support all of our healthcare partners, clinical providers, insurers, their patients, their communities to adapt to climate change now that it's here. You can also check out our website. You'll find a series of companion resources that can help you get started. There's no bigger challenge than climate change, and we need to work together on this. I hope you find some knowledge and some inspiration from our guests over this talk. Thanks for joining us.
My name is Srini Pandikatla, and I'm the Sustainability Director at Seattle Children's. I'm here today to talk about mitigation in the healthcare sector. What is mitigation? When we're talking about climate change, mitigation means reducing and stabilizing levels of greenhouse gas emissions, or GHGs, in our atmosphere caused by the burning of fossil fuels. You might also hear the term carbon footprint, because carbon dioxide is one of the major gases contributing to global warming. Nationally, the greenhouse gas emissions produced by the healthcare sector account for 8.5% of total emissions in the US, so it's a significant amount. Globally, healthcare emissions are estimated at 5%. The US has the highest emissions per capita among industrialized nations. This image shows some of the many ways that healthcare contributes to climate change, including energy used to run buildings, many of which operate 24/7 year-round, employee commuting, supplies and equipment needed, and the resulting waste generated from patient care. When we break down the numbers, we can see that the bulk of healthcare emissions come from the supply chain. That means the production and distribution of items and services that healthcare systems need to provide care to patients. This includes medical supplies and devices, medication, and administrative services, among many other things. So how can healthcare systems reduce their carbon footprint? The top 3 actions that health systems in the US are taking include starting a green initiative, switching to LED lights, and reducing waste. A green initiative can also be known as the Green Team. It brings together staff focused on sustainability to identify actions and bring momentum to change. Switching to LED lights is a relatively simple action that reduces how much electricity you can use. In most of the country, that electricity is powered by fossil fuel sources. However, in King County and the Pacific Northwest, that's less of the case since our electricity is powered by hydroelectric and other more sustainable sources. Lastly, reducing waste means that less ends up in landfills, where it would produce methane over time. Methane is another greenhouse gas, and it's about 30 times more potent than carbon dioxide. Here are some other actions that healthcare organizations can take. Broadly reducing energy use in the building, and specifically in the operating rooms, as they are a particularly resource-intensive area. Using alternate transportation methods, King County Metro and Sound Transit are great alternatives to driving alone, and educating workforce members, patients, and the community on becoming more sustainable focused. I'd like to talk a little bit now about what we're doing here at Children's. Seattle Children's mission is to provide hope, care, and cures to help every child live the healthiest and most fulfilling life possible. We are committed to improving the health and well-being of our patients, families, workforce, and community, and that includes promoting a healthy environment and our impact on it. Our first goal is to become carbon neutral by 2025 at our hospital campus here in Seattle. Carbon neutral means to cancel out emissions by purchasing what are known as carbon offsets. This money goes toward funding carbon-saving or carbon-reducing projects off-site, such as investing in new renewable energy facilities. Now, there are many categories of emissions to think about. The EPA calls them Scope 1, 2, and 3 emissions. Scope 1 are directly occurring emissions, mainly from burning fossil fuels like natural gas to run buildings or gasoline to drive fleet vehicles. Scope 2 emissions are indirect. They're derived from purchasing electricity. Scope 3 is also indirect supply chain emissions, such as goods and services, waste, commuting, business travel, and more. Our goal is to offset all our Scope 1 and 2 emissions and some of our Scope 3 emissions, namely our business travel and employee commuting. Since 2018, we have also offset 10% of emissions with the tree planting partnership with the local nonprofit Forterra. Being carbon neutral means we're taking responsibility for our current operational impact on environmental health, while at the same time, we continue to decarbonize operations to meet net zero goals. We have signed on to the Health and Human Services Healthcare Climate Pledge, which is a voluntary commitment to cut our emissions in half by 2030 and be net zero by 2050. That means by 2050, we would not produce any emissions from our operations, whether through efficiency or using renewable energy sources. How are we doing so far? Since 2018, we've reduced the relevant carbon neutral emissions categories by nearly a quarter, and overall emissions by 10%. Mostly that has happened by optimizing building operations to consume less natural gas and reducing purchasing in some areas. This is during a period where we expanded our hospital and opened a new wing, the Forest B building, which added about 30% more square footage to our site. So even with increased energy use and resources needed from that expansion, we've still managed to reduce our emissions significantly. Here are a couple of things that helped us succeed. For one, it's important to have data to understand the scope of what we're doing. We have many ideas of what to do to reduce our emissions, but utilizing a data-driven approach helps us be more strategic. We can see where opportunities are to have the most impact, and we can measure change from a baseline as we implement new programs. Second, sustainability partners with a lot of different departments throughout the hospital. This includes facilities management, environmental services, food services, transportation, clinical teams, and sourcing, to name a few. The real change happens in the day-to-day work of each individual department and person. That means you need collaboration and buy-in to the team and organizational goals. It really is a group effort throughout the hospital. So how can you take action? It depends on where you are in your own climate journey as a healthcare system. If you're just starting out, forming a green team is a good place to start. Education is also important to make sure all staff is aware and on board with your new programs. For example, you can put compost and recycling bins all over the hospital, but it won't help much if staff don't know how to use them, how to sort properly, or where it goes once collected. Finding data is important to quantify your energy consumption and fossil fuel usage through utility invoices. And if you've already done those things in your organization, some intermediate steps include strategic planning around your GHG reduction. Build support and find champions at all levels of your organization, and stay on top of local legislation. Some state and local city legislation has driven our planning needs. Others are voluntary commitments. Lastly, join Practice Green Health or another healthcare sustainability organization to learn more and support your own sustainability journey. We are constantly learning from each other. Each health system can do a lot, but we can share knowledge and lessons learned and encourage each other to create lasting systemic change.